No? Well, hello everyone. Happy Monday and welcome to Zoom into Wellness. My name is Shalaya Yazdi, an osteopathic medical student at Touro University, California. I'm here today with my mentor, Dr. Jay Shubrook, who started this program last year so that we can raise awareness about health and wellness, especially as it pertains to diabetes management and treatment. I'd like to welcome Marlayna Bollinger, who is the founder and executive director of the Skinny Jean Project, and Dr. Jay Shubrook, who's here with us today. Thank you for joining us. Anyone?
Thank you for having me.
And Marlayna, we're really glad you're here. You know, we have gone back a little ways with our diabetes prevention efforts, and really, I'm very inspired by the work you're doing. You know, you have really been a force for Southern California as it relates to diabetes prevention, engagement, and you know, your Skinny Jean Project was the first in San Diego County and the third in the state of California to be awarded full recognition, CDC recognition for the diabetes prevention program. And you know, part of why you're successful is because you have a background in creating businesses. So you know, strategic marketing background and over 17 years as a diabetes prevention advocate. So you are an expert in this area, and have really enjoyed to see what you've done with your diabetes prevention program and really providing this for our most vulnerable communities. And I appreciate all that you have done.
Well, thank you, Jay. To be honest with you, we're just chasing you. I remember the first time that I heard you speak at a conference, and at that time, yeah, I was just listening to. I was aware of some of the other efforts that were happening, and just they seemed elementary compared to what you were doing. And so I just remember being so impressed with all of the activities coming out of Touro University, and even the Wilma Bill, and just all of those things that were just outstanding. And I said, one day I'm going to be like Jay. Haven't gotten there yet, but I'm working on it.
Be careful what you ask for. So if you would tell us a little bit about the Skinny Jean Project. It certainly is a catchy name, and I'd like to understand a little bit more about it as we start to talk about involving the family in health and illness.
Sure. So the Skinny Jean Project is a organization that primarily offers diabetes prevention classes, but we also now have grown to provide a little bit more, I say, umbrella services or structure to assist other organizations in building their diabetes prevention programs. We are very much interested in increasing access, and we believe that every person, regardless of their zip code or ethnicity or language or insurance, should have the ability to prevent type 2 diabetes. And so we started off in San Diego, but we're really interested in ensuring that access is available for everyone nationwide.
Wow. And how did you get started in this business? I mean, that seems to be quite a niche, particularly with your background.
Yes. It's interesting because I always thought I wanted to be in advertising. My mom would make fun of me because the TV would be on and everyone's watching the show, and I couldn't care less. I couldn't care about the show. But then the moment the ads came on, I was like all in. And so I did. I followed my dream and went to Chicago, worked for a giant advertising firm, and realized in the process it just wasn't fulfilling what I needed somewhere inside. And in 2001, I had lost my aunt to type 2 diabetes. And the opportunity arose for me to work with a neurosurgeon on a product that was coming out to help regulate blood sugar. And so I was very cocky and young, and they told me their marketing plan. And I said, well, that's the dumbest idea I've ever heard. And they said, okay, well, hot shot, then why don't you tell us what you do? And I said, I will. So I spent 6 months researching diabetes and prediabetes. And this is the same year that it came out. And in that process, I realized that light bulb went on for me. And I was like, wait a minute, I just lost my aunt a year ago to something that's preventable. Why aren't we having that conversation? Why is it that after the fact, after the sadness, after all of those things, then we're like, oh, by the way, we could have prevented that. And so that was the catalyst for me. I think just the wake up call of realizing, that there is this epidemic, and it's preventable. And I just could not wrap my head around why that wasn't being discussed. And from that moment on, I became a diabetes prevention dork.
Mm. And of course, this is not nearly as lucrative as any other advertising, right? I mean,
Yes, I don't get taken out for lunch or dinners or anything, but it's definitely more fulfilling.
and I agree 100%. So I think that this is important that, very few people I think are aware that prediabetes doesn't have to go to type 2 diabetes. I think most people don't know that they have prediabetes. So maybe through your lens, and I know we'll get to family, but through your lens, what could we be doing better to raise awareness about prediabetes, and really that this is not a fatal march to just death? We could do a lot of things to prevent this progression.
Absolutely. I think the number one thing that we need to do is change the conversation about it. Prediabetes has somehow become either normalized or swept under the rug, as though it's something that if you get a chance, hey, by the way, you should try to do something about this. It's not at the forefront. And because it's not at the forefront, I think that people dismiss it. How the provider lets them know about it and how seriously they take it is how the information is going to be received and therefore acted on. And so I remember in the very early days when I was working on different things like that to 2002 and working on the initiatives, doctors didn't even think that prediabetes was a thing. And so, and some of them still don't. They either say you either have diabetes or you don't, right? And we know that's not true. But I think that changing the conversation and having healthcare providers in general take it a little more seriously, and encourage people to do something about it, and not just say, hey, go do it on your own. But the second part of that conversation needs to be, hey, first part needs to say, hi, you have prediabetes. Let me tell you what this means. And two, let me help you. Let me provide you or direct you into the right direction for services. And I think until those things happen, we're going to continue to see what we see.
Yeah, and I think that there's still really an unacceptably low awareness amongst healthcare professionals about not that that prediabetes exists, but there's something you can do about it. And so I guess in your actions, how have you been able to increase uptake so that more people are getting the care they need to actually prevent disease?
I think that in our world, it's all about finding that champion. There's amazing doctors out there that really do care for the health and well-being of their patients, and they go above and beyond. As with most healthcare providers, a lot of them are spent, right? They're just overworked and they want to do more, and some of them just don't have that bandwidth. And so I think with us, the process has been saying, I know that you care about your patient. I know you want to do more and just don't have time. So let us take some of that for you. Let's work together on this. That's been the primary way that we've been successful, is just partnering with providers over one shared interest, which is improving their patient's health.
Yeah, that's wonderful. And again, you certainly have developed a very successful program. So I want to pivot a little bit to family. And, I think that, part of our theme this month is really the role of the family in protecting health and preventing illness, but also on the flip side, I guess, contributing. So in your experience, how can you leverage the power of family? Let's start specifically with diabetes prevention.
Well, I think that preventing diabetes is very much dependent upon the relationships that you have with your family and those that can help you, because it's either going to either help you prevent it or it's going to kind of help you progress towards it. That's the thing with prediabetes, you're not really standing still, right? So for me personally, I think when I look back on my own family history and in my own aunt who died of diabetes, we look for those opportunities for people to have intervened. And in my situation with my aunt, my family, those around her were uneducated. and they watched as my aunt was type 2 diabetic, but she's 100 pounds soaking wet. So there is that stigma of, well, you can't have diabetes because you're not overweight, right? Which we know is false. And then when she stubbed her toe and it became infected, gangrene, and turned black, family members thought that her toe turned black because she smoked too much. There wasn't that association. There wasn't that decision or that call to say, hey, I think this is wrong, or hope it seems like you're not feeling well. What are you doing about that? There wasn't an encouragement to go to the doctor. And I think that when it comes to prediabetes, because it is asymptomatic, but it will, if not, you don't do anything about it, will develop into type 2. I think that family units need to be and realize that it's not a you problem, it's a we problem. And the same thing with community. We need to stop ostracizing the individual, and we need to say, you know what, we're going to do this together, because habits are created internally, but in order for them to be successful, we need everyone to be a part of those healthy habits. So I think that the role, in my mind, of the family in prediabetes is by saying, the moment you feel that you want to kind of take that other, that other branch, and do something about it, then I'm there with you. I'm there for you. I think that's the most important thing that family can do, is just kind of be there.
Yeah, so I heard you say a couple really important things. One is acceptance, right? We have to know that these chronic illnesses are not things to be shamed or blamed. They're things that happen to us, and we're all in it together.
Yes.
Two is advocate for early intervention if there's a problem.
Yes.
And then three, follow through, which I think is so important. And I think I love that you defined family a couple different ways. It's not just maybe your nuclear family. It might be your workplace, your extended family who lives in the house. Sometimes we have multiple generations in a house, or maybe even your community of worship. So that family is loosely defined, but if we go at it like we're in it together, then we're more invested.
Absolutely. I always like the phrase that says that what's the difference between, illness and wellness? It's when you swap the I for we, right? When you
Oh, I
single
love
someone,
that.
yeah, when you're if you're singling somebody out, then you are setting them up for illness, right? But when we change the I into we, and we come together to work towards something, then that becomes wellness. And wellness really is a community effort. You cannot be a healthy person in a unhealthy community. Eventually, something's going to have to shift. You're either going to have to leave the community, or it's going to, pull you down. But you can't have both.
Yeah, boy, that's really hard, because I think many people feel like they're stuck, and may not know the path to and it can be a virtual community, it could be a theoretic community. Those are really important points. How much, last month we talked a bit about engaging healthcare with the provider, and I think that there's issues of trust, there's issues of being heard. Any advice about trying to make sure that, as we think about that family or extended family, how does that healthcare professional become part of that?
I think that it's making sure that you are able to convey to the healthcare professional that you want to be part of the decision-making process, that you want to be able to not just advocate for yourself, but work alongside the physician. It's just like any other conversation, right? When you go into any conversation, the idea is to find common ground. And sometimes if we come at it very combative, then that's going to push the healthcare practitioner back a little bit. And sometimes it's hard for them to figure out how do I address this, or how do I bring this to your attention, and are you going to care? And so coming to the table to say, listen, I'm open to improving my health, and I want to know what I can do to improve. That kind of takes away some of those barriers, so that you can have a more constructive conversation and therefore have better outcomes.
Yeah, that's really important. I feel like so often healthcare professionals are in a hurry. And I also feel like, well, this is my take on it, and maybe this is not an accurate take, but I feel like most people don't know what they don't know. And if they don't have any idea, if there's no symptoms of the condition, how can they possibly initiate a screen, right? I mean, I think that's part of the concern. So it's almost like putting the onus on the healthcare professional to say, look, we have known screening programs, you should be doing this.
Mhm. It is, and I think that that's I don't want to use the word fair, but I think that it's not balanced. I think that we are ultimately responsible for our own health, and healthcare providers are there to assist us and guide us and provide us with information so that we can make educated decisions. But it really has to be on us in order to say, what do I need to do? And being proactive about prediabetes or diabetes prevention is a big part of that. To say, okay, I'm going to take the 5-finger test, or I'm going to do an at-risk test. I'm going to look at, do I have family, brothers, sisters, parents that have diabetes? Am I active, or am I more sedentary? People know how their energy levels are, right? When you are more exhausted. And so just really striving for optimal health. And if you aren't in optimal health, then what can you do, or what can you, how can you relate that with your physician and say, hey, this is how I'm feeling. I would like to talk about preventative measures for anything. But diabetes is definitely one of them, especially if you have a family history. So I think that it's just like a conversation is two-way. You can't just show up and keep your mouth shut and hope you get everything. You have to participate.
Yeah, advocate, right?
Yes.
So how does, I think that, certainly this is well within the things that you see all the time. If I have a family member who's had diabetes or pre-diabetes, how worried should I be about diabetes?
Well, I think that if you've had a family member that has had diabetes, then it's important to know that there is a risk, right? There is a genetic component. A lot of people think of genetics only in terms of type 1 diabetes, but there's a genetic component in relation to type 2. And then I think that you have to, after that, you have to think about your own lifestyle, right? If you have a parent that had type 1, or type 2 diabetes, but you are extremely active, um, then maybe there's a lower chance. But either way, you should have, in my opinion, your annual physical, and you should on occasion ask for a hemoglobin A1C test. That is really the best way of knowing and having that confidence and reassurance, is just get the test. Because it doesn't knowing that you have prediabetes means you have an opportunity. It's not a diagnosis of saying like, okay, shamed and now you're in trouble. It's like, okay, great. You know what? It's a little bit of a wake up call. It's a yellow light, right? And so you've got to take advantage of it at that point in time and do something about it. Don't ignore it, but it's that wake up call. And so we should be great. To me, it's a positive thing to find out that you're heading in the wrong direction so that you can turn around.
I think that's a really important perspective because, some of these risks we're going to just have, right? And, the fact that we find out we have something like prediabetes is a gift, that we have a chance to do something to prevent diabetes, not a punishment like, oh my goodness, that's too late. Now I'm in trouble. And I think
Right.
that I rarely hear that. And I think that that's an important perspective.
Absolutely. There are how many people that have type 2 diabetes uncontrolled and have had an amputation or two, and they're wishing that they had done something earlier. Having that chance is a gift
That's
if you
absolutely
use
true.
it.
And I know that you know this because this is the work that you do, but if someone wanted to do the diabetes prevention program because they found out that they or a family member have prediabetes, is this an effective program?
Absolutely. Absolutely. We talk about the success rates, if you complete the program, successfully all the way through and follow the different things you need to do, then you're going to reduce your risk of developing type 2 diabetes by at least 58%. If you're
Wow.
older, 71%. There aren't very few options out there that have that type of success. But it's more than that. It's not just about preventing type 2 or reducing your A1C, your blood sugar levels. It's also about finding that community and finding that structure to support you. So could you go and do some diet? I hope not. But if you were to and you were to lose weight, that may happen, but you may find yourself alone and you may not have the tools. The diabetes prevention program is about providing you with the tools to be successful long term. And part of those tools is community.
I think that that's so important because, as you mentioned earlier, if you're in a community of unhealthy behaviors, sooner or later it's going to affect you. And so something that the diabetes prevention program does is it helps you to create a new community who has a shared interest and hopefully similar lifestyles.
Absolutely.
I love that. I love that. I think Shalaya has a question for us.
Sure.
I do. Thank you. Many of the highlights of our discussion today have included community and structure to support someone throughout their journey for preventing the onset of type 2 diabetes. We have these amazing resources available to us, but how can we harness the power of family, whether it be nuclear, extended, or community, to improve our health personally and community-wide?
Man, the power of family and community is so important in a journey. And I think that what we have to do is we have to look at what I call it gathering your assets, right? And you have to be able to identify at least one person that is close to you that you could ask to walk through this with. So often family is, we're afraid to let them know what's going on. We don't want to let them in. We're worried about the criticism. We're worried about all these different things. And I think that the best way to harness family is to say, I want to do this together with someone. And I want to know if you would be willing to be that person with me. It doesn't mean that that person becomes their coach or is telling them what to do. But it is a person who is going to support them, not shame them, but support them. So often family can make someone feel isolated. Oh, I used to have these wonderful dinners and then my mom decided that she wanted to go and do this and now we have to eat rabbit food, like those types of things are not encouraging. Having a person have to prepare one meal for themselves and something else completely for the family, eventually that's not going to set the person up for success either. So I think that inclusion is the best way to harness the power of family and community and just really be open to, I need someone in my home, someone in my work, someone in my friend group. I need someone in all these aspects of my life where I pray. I need someone in each one of those places that's going to know what I'm doing and is going to help celebrate me. So if they can't walk with me, they're going to at least be on cheering squad.
I think that's so important. So what you've done is essentially, I hear you say, don't go it alone. Surround yourself by people who are going to support you, not bring you down. And again, we kind of highlighting the role of, however you define family, they can be a detractor or they can be a strength. And sometimes it does require you to redefine who that family is. Not that you're going to not see your mom or your whoever, but
Right.
your health family might end up being different than maybe other definitions of family as necessary.
Absolutely.
Wow.
Just like in any other group, right? If you are going to a place of employment, many of us want to find a work buddy, right? Someone else that we can be there with or go to school or whatever it is. We as humans, we need to be supported. We need to not feel alone in our journey. And I think that the shame the unnecessary, incorrect shame that comes with having prediabetes or diabetes, it really changes someone's mentality and makes them think that they should be isolated when they shouldn't.
Mm,
You know, if it was, let's replace it with something like cancer, which is incredibly unfortunate. And I'm not trying to compare prediabetes to cancer. I am saying if somebody was, we don't expect somebody with cancer to go at it alone.
for sure. So, a lot of your work is focused on disadvantaged populations. And we certainly have known that prediabetes has not affected everyone equally. What are some strategies that we make sure we're getting the care and the help for people who need it the most?
I think improving access, creating information. So you can have the best programs available, but if people are unaware of them, then they're of no benefit, right? So I think ensuring that programs are accessible and people are aware of how to access them and removing those barriers as much as possible. So if transportation is a barrier, then we need to remove the transportation. If child care is a barrier, we need to remove the child care barrier. You know, we have to provide child care. It is hard enough for someone to step up and say, hey, I want to do this, without having to bring in those other pieces that make it difficult. So I think we need to understand where the person is, what their needs are, and make sure their needs are being met so that they can be successful in the program.
Yeah, and that is rather complicated. So you mentioned those things, and I think, I think of our own journey. Certainly, we want to we want to inform. So we inform in places of worship. We inform at daycares. We inform at barbershops. We inform wherever that is, right? We want to go where people commune. But those issues of access are often multi-layered. And I find that there's rarely a simple answer, right? If someone, has transportation issues, well, they have transportation and childcare, or transportation and safety. Have you had any successful strategies in terms of addressing those?
Yes, I think that first of all, what we've done internally is we've started to do a needs assessment, and we start to do a needs assessment the moment that someone is interested in enrolling in the program. That way we can understand all the things that we need to do to take care of that individual. Some of them are, we're only diabetes prevention folk, but we partner with other organizations that can step in. Whenever we work with a new site location or a new contract, we'll ask them about additional services that they offer or provide. So I think understanding and anticipating that someone's going to come to us with additional needs, and already having a strategy in place of how to connect them to the proper service providers, and also being understanding. For example, with Zoom, our population had never been on Zoom before. And so saying, okay, well, instead of just giving you, saying, oh, just show up and do this, we have to do Zoom classes. We have to make it so that people can understand what's going on. So I think it's really about equity and trying to provide as many resources as possible so that we have a more equitable situation.
Yeah. So I want to make sure I summarize here. So I know that if you or someone out there is listening and they have diabetes or prediabetes, or someone in your family has prediabetes, probably the most important thing you can do is be supportive and engage them in the process of health rather than stigmatize or blame. And know that we are a product of our community. And so it's just a matter of time before it's going to affect us. And isn't it better to be part of the answer than part of the problem? And that there's already enough blame to go around. So we might as well let that go and engage in the answer. and that there are good programs, right? There are programs available that can really help. And if you don't have, and again, I'm happy to be corrected if I heard this wrong. If your family, as you define it, is not already supportive of this process, you either got to engage them or change or recreate or redefine who that family of health is.
Yes,
Yeah.
absolutely. Yes.
So such important things you've shared tonight. And I think that too often we think of health as an individual journey. And we know it's not, right? I mean, we have seen that in so many ways, and certainly between climate change and pollution. I mean, we are in it together, whether we like it or not.
Whether we like it or not.
Yeah.
That's right.
So if you were any closing comments that you'd want to share with the community, what would you like to share in terms of the role of family, diabetes prevention, engaging in health?
I would say I once heard a statistic that really shocked me, and I want everyone to know what it is. And it's that your zip code is a better predictor of your health than your genetic code. And I think that when we talk about family and protection and love and all of those things, we need to also identify, what does that really mean? What does love mean? What does protection mean? And to me, love and wellness, or love and protection, they all are they all go hand in hand. And so I want to say that if your zip code is a predictor of your health, then we need to do our part within our communities, within our zip codes, to include and make sure that all of us have equal access to health and the opportunity to improve our health. So we need to be in community with each other in order to change those statistics.
Yeah, and that is, I think it's important to make sure that the listener hears that is a multi-layer approach. I mean, of course, we're going to do policy and things like that, but we can't wait for that, right? We have to actually act now and take charge of our own community, whatever community that is, and say, look, I'm going to do something to improve the health of my family, if it's, as we define that.
That's right. Exactly. It's all about expanding the idea of family.
I love it. Well, family as a unit is a well-defined thing. And I think it is something that we all have, right? I don't know anyone that doesn't have some sort of family, right? It might look different. It might be different people, but whatever that is, they're the people that go with us. And I think we should invest in our family like we would invest in ourselves.
Yes, I love that. I love that.
Well, we really appreciate you joining us tonight. You have just an inspiration, and I love the work that you're doing. And, I think it is just wonderful how you have been able to engage and make a difference in your community. And we're glad that you've been willing to share some of your insight with our community.
Thank you so much. Thank you for having me.
Yeah, thank you very much.
Thank you. That was very inspiring and informative, and we really appreciate that you were here. These Zoom into Wellness webinars are all recorded and posted on our website at www.tu.edu/MOBEC/Zoom into Wellness. Thank you so much for being here tonight.
Thank you.
Yeah.